is having a mental health provider that is very familiar with the culture, the differences, and where the problems are in healthcare delivery. And that often comes from a person who is from the same culture, understands the culture, and, for example, someone who grew up in the area, we might say someone who grew up in the hood, or someone
right.
that, or someone who has continued to have an interest in working with underserved populations.
Right.
That can also be very helpful in bridging gaps.
Okay. So what do you think causes these healthcare disparities? Have any studies shown what specifically is causing the healthcare disparities?
Well, a major cause of the healthcare disparities we know is racism. Racism in the form of socioeconomic disadvantages, less access to educational advantages, and also actually just the experience and trauma of racism can actually physically cause a decrease in someone's health status or a deterioration in health status. For example, there have been studies, various studies out of Harvard and other very well-known institutions that have proven that there is an increase in, for example, abdominal fat.
Okay.
In our family, we call it belly fat.
Right.
That is as a result of racism and constant microaggressions and other experiences that are beyond the person's control. And actually, those studies have shown that this is related to the hormone cortisol is produced when people are under stress. And that causes a gathering of, abdominal fat and that can lead to high blood pressure, high cholesterol, high fats in the blood, and also can lead to diseases such as strokes and other problems, heart problems.
Okay.
So that's one way.
Yeah, I see that. We see that in our community. That there are these differences, and like you explained, that what causes these healthcare disparities, but they affect minorities, and they affect African Americans and Hispanics, and different types of minorities more so than the overall general population of non-minorities. And I wanted to backtrack a little bit because we're talking about minority mental health awareness and addictions. But what exactly, you hear all the time, opioids. Can you describe what exactly the meaning for opioids are? Is it prescription drugs mixed with street drugs, or is it street drugs, or what is actually the definition of an opioid?
That's a good question. Well, opioids are basically medications that are derived from the opium plant, and or medications that are manufactured on the street that have the same properties and the same or similar chemical structure to the opium plant, so derivatives. So
okay.
basically, opioids are anything that causes a type of intoxication or a high that it causes a very pleasant feeling of well-being, and it also depresses the adrenaline rush in various organs. For example, when a person is intoxicated with opioids, they might have a decreased rate of respiration, a slowing of the heart rate, and other functions in various parts of the body are lessened. So the medication actually it just causes a very pleasant, euphoric experience, and that is why it is so addictive.
Oh, okay. Now, what are some of the signs? Because, sometimes people wait and they make up excuses for not getting treatment or not seeing problems in their loved ones or friends. But Dr. Jones-Fearing, what are the signs that someone? Well, before we get to that, but the question is, what are some of the signs that someone is in need of mental health? Before we do that, I'd like to have a brief word from one of our sponsors, and we'll be right back. Hold, please.
Let's be creative with Carey. Caricatures by Carey, available for weddings, parties, anniversaries, corporate events, and more. Children's book author, superheroes, and cartoon illustrator, logo and graphic designer. Contact Carey for your customized creations. Caricatures by Carey at gmail.com. Connect on Twitter and Instagram with hashtag Caricature Carey and check him out. www.careygjonsondraws.com.
And we are back. You're listening to Partners in Health and Biz. I'm your host, Gail Dixon, and my special guest, Dr. Kim Jones-Fearing. The topic this morning, addressing the minority mental health crisis. And so we're going to just keep moving along. And Dr. Jones-Fearing, again, what are the signs that someone is in need of mental health treatment?
That's a very good question. People often suffer from milder levels of just feeling. They call it feeling down or feeling blue. Everyone knows what it's like to lose a loved one or be very disappointed. There might be some tears, but when this feeling of low mood, depression continues beyond a month or two in time, or when the person starts withdrawing from people that they had normally had contact with, or they start having lack of enjoyment in activities that used to be very pleasurable for them, hobbies, activities, going out, they start isolating themselves, or they start also having problems functioning at work or functioning in the home. Those are signs that that a person needs to seek mental health treatment. And in children, it can be tricky because there are so many factors involved with children that interfere with really detecting problems. Children tend to be less verbal in terms of knowing really that there is a problem. So it's dependent on the parent to notice any changes in their behavior, like a child that used to like to go out for ice cream with the family is all of a sudden not wanting to go out, or someone who used to like sports is all of a sudden not participating, not wanting to get up, or or an academic problem where there had not existed one in the prior.
Okay. And a lot of people say, will say to someone who is addicted or on drugs, why don't you just stop, using drugs? You're ruining your life. Why don't you just quit? So why can't people just stop using drugs on their own, Dr. Fearing?
Well, that's the $1 million question. And
right, yeah.
And the problem is, what most people don't understand is that drugs that are addictive, whether they're physically addictive like heroin, or whether they are associated with a physical withdrawal syndrome such as heroin and other drugs, or are they mainly causing emotional problems and maybe some physical problems? Like, for instance, there are drugs like cocaine and methamphetamines that cause you don't really treat those with specific medications for the withdrawal. However, people really
We're
do
down
suffer
to 4
physically.
minutes, so I do want to get the rest of a few more questions.
Yes,
in. Okay.
yes. So basically, drug addiction is a medical problem. It's a medical disease, and it has to be treated by treating the not only the person with the addiction, but also the family.
Okay. So, are there any medications that a person that can help a person stop using street drugs? And pretty much, yes. Are there any medications that can help a person stop using street drugs?
If a person has an opioid addiction, there are several drugs that have been approved by the Food and Drug Administration that are helpful in decreasing the withdrawal. And Suboxone is one of the newer ones. And Suboxone can be given in a physician's office, and it immediately works within minutes to stop the withdrawal symptoms. And it's a film or a pill that is dissolved under the tongue. And it goes directly into the bloodstream, and it blocks the receptors that lead to the cycle of addiction and withdrawal. And it's not just the pill that's going to help. It has to be also given with treatment such as therapy, counseling, and or self-help groups in order to be effective.
Okay, great. So, can you tell us how people can contact you if they need help, or what should they do if they need help with any type of mental health illness? Where can you direct them?
Well, I would recommend that people, if they think they're having a problem such as addiction or a mental health problem, the first person they should see is their primary care doctor. Their primary care doctor already has a relationship with them, and their primary care doctor can refer them to a mental health facility or a professional that they feel will be the most helpful for the patient at that particular time. And oftentimes the primary care doctor can get them started on medications such as antidepressant or medications that might help them with their addiction.
Okay, and how can people contact you? We're down to 60 seconds here.
Okay, they can contact me at the clinic where I work in Baltimore, which is New Vision, or they can contact me if they're in Columbia area. They can contact me at my private practice number, which is 443-5